Let's talk about early symptoms of leukemia. Interesting enough, I've seen a bunch of cases of acute leukemia this week, and so let's talk about it. My first patient, no symptoms whatsoever. He went to his primary care doctor for the first time in 2 or 3 years because he was feeling well. He's like, you know what? I got health insurance, I got a good job. Let's go get my blood work done. On the CBC, blast cells, which are considered cancerous cells. Next thing you know, he's getting called from his primary care doctor to come to the emergency room and come see me. So the first sign of leukemia could be no symptoms. You could feel perfectly fine, and by chance, complete chance, you found that you have acute leukemia in your blood. And acute leukemia can kill you in weeks. That means they were lucky. And I swear to God, I see a ton of patients like that. The second symptom are infections, constant infections. You're constantly getting sick. Now, I know a bunch of you are going to start jumping, oh my God, I get 5, 6 colds a year. I must have acute leukemia. Acute leukemia kills you in 5, 6 weeks. It's very, very quick. It's very aggressive. But if you are getting sick quite often, go see your doctor. Get a basic CBC. If there's blast cells or you have a high white count that is not explained by your current infection, then you might need to see a hematologist to get worked up. 3 is bleeding. You can have some type of venous bleeding, which is like a nosebleed, bleeding in your gums, bleeding in your abdomen from a large vessel, or capillary bleeding, like bruising throughout your body. A lot of times I see abdominal bruising. If you have unexplained bruising, especially from no trauma, you're bleeding from your gums, you're bleeding from your nose, you have no explanation, then it might be a consideration to get a CBC done to see if you have any immature cells. B symptoms. That includes weight loss. So if you're losing 20 to 30 pounds very quickly in 2 to 3 months, and you're not dieting, you're not exercising, or it's more than you've ever lost before, go see your primary care doctor. Other major ones are fevers and night sweats. If you're having fevers off the day of 100.4 or higher, or if you're having night sweats, and I'm talking you're sweating your bed, it's soaking wet, you can't wear clothes, there's towels on your bed, and it's soaking wet, go see your doctor. These are all considered B symptoms, and they can be a sign of any cancer. Now, these are called early symptoms. There are obviously late symptoms of cancer that are much more aggressive, but if you have any of these early signs of acute leukemia, go see your primary care doctor and get evaluated. Just remember, acute leukemia is extremely rare. There's only about 30,000 diagnoses per year out of 300 million Americans. So I don't want you to panic if you have any one of these symptoms. Go talk to your doctor and get basic blood work done. There's dozens of diseases that could explain any one of these symptoms.